and Brad, the two most famous physical therapists on the internet.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
All right, and it's our opinion is the one that matters.
Exactly. Let's go to work.
Okay, today we're going to talk about how to stand up, how to get out of bed when you have a herniated disc, or maybe when you just have really bad back pain, acute back pain.
Right.
Because there's techniques that are really going to help you.
Right. You can either do these movements wrong and make the pain worse, or not let it get better, or do them this way and allow them to heal.
Yeah, your back's going to teach you a lesson if you don't do it right.
Exactly. So getting out of a chair. Okay, first of all, when you got that herniated disc or back pain, you want to think about good posture while you're sitting, not this.
You want to stay as straight as possible.
Right. And now when you get up, this is the key. Normally when you get out of a chair, this is normal mechanics.
Right.
Those are the mechanics that are going to irritate.
You're bending way forward to get your nose over your toes, we say. And
that's just normal. It makes it easier. Okay, but with the disc, why don't you, they're going to put that PVC pipe on my back just to represent good tall posture. And now when I stand up, I have to keep my contact with my head here, my back, and my low back. They're all making contact with
all one unit.
So I know I'm straight, and I'm going to slide forward to the edge of the chair. And it really helps to have armrests on your chair. And I'm going to go straight up. There we go. And carry on. Now, this is something with our patients. We go through this in detail, and we make them get up like that so they know how to do it, and before they leave, so they know exactly how to do this.
If they don't have armrests on the chair, sometimes we just have them turn in the chair like this, and then they can use this side at least to push up and help them, give them a little boost.
Right. It's no different than picking up an object like this as opposed to like that.
Brad, why don't you show the one way of getting out of bed?
Yep. So the transition from the chair to the bed, same concept, keeping that back straight. And when I have someone...
Oh, you're going to do that one first?
Yeah, done on the stomach.
Yep.
Okay. So what I have people do at home is I'll tell them, roll over, and we'll practice this right in the clinic and make sure they know how to do it. Keep everything straight like your body's a log.
So you're rolling over like a log,
Therapists call that log rolling, so it's not like the log in the water going... Get it, Bob? Yeah, that was funny. Okay, then you take the closest leg and you go down till your toe touches. Okay, and once your toe touches, you know where it is. It gives you a sense of confidence, and you go to the next one till it touches, keeping the back straight. And
again, here, you know, he's keeping his back straight the whole time.
Right. Now my hands walk up the side, keeping that back straight. Up, 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 and there you go, and you go from there.
Well, I got to tell you, Brad, because this is the way we were taught initially to do this. Is we were taught you roll onto your side, and then you bring your legs off, and then you push up and keep your back straight like this. I hurt my back once, and this was a few years ago, and you had just showed me that other technique, the one that you did, and I could not get up like this. I literally, I mean, it just hurt too bad.
Sure, too painful.
So thankfully, I was able to do this, and I could get up. You can really keep it straight. And get it down too. I mean, I didn't know what I was going to do because I couldn't get into bed. So it's not a, it's not a minor thing.
This is one of those savers to take that pain to a level you can accept.
Well, one of the things too, which you may not realize, at night your discs fill up with fluid. So if you have a herniated disc, it actually fills up with fluid. A lot of times it's worse in the mornings when you're getting out of bed. And that's the worst time to bend forward and make the disc worse.
Exactly.
And so that's really important that you get out of bed correctly when you have the herniated disc.
But wait, Bob, there's more.
There's more. Brad has more.
I just really wanted to say, Bob talked about going back into bed. It's just the reverse. You face the bed, and then imagine that PVC pipe is still on your back. I tell people, imagine there's a 2x4 taped to your back, and you're going to not let it bend and keep it with you. And then roll over. And this happens pretty slow when your back is really sore.
Right, you can take your time, but any one of those movements can set off a spasm, so you really want to make sure you're as straight as possible.
The one thing this reminds me of, Bob, as I've been working on this over the last week, and I'm thinking that there's some way we can, and I got a new idea. I'm going to go out in the garage and get my welder for a broken heart. We haven't worked on that yet.
You can fix just about anything.
But a broken heart.
Broken heart. And
oh, yeah.
There it is.
It's amazing how it just appears up.
And it's fixed now.
I'll just You got it.
Thanks.